All right. Virtual meeting statement pursuant to Governor Baker's March 12, 2020 order suspending certain provisions of the open meeting law GLC 30A, Section 18, and the Governor's March 15, 2020 order imposing strict limitations on the number of people that may gather in one place. This meeting of the Hubbardston Board of Health will be conducted via remote participation to the greatest extent possible. Specific information and the general guidelines for remote participation by members of the public and or parties with right and or requirement to attend this meeting can be found at www.hubbardstonma.us. No in-person attendance of members of the public will be permitted, but every effort will be made to ensure that the public can be adequately access the proceedings in real time via technological means. In the event that we are unable to do so, despite best efforts, we will post on the town's website an audio or video recording, transcript, or other comprehensive recording of the proceedings as soon as possible. All right. First item on the agenda tonight is to review the meeting minutes from 1/12/2021.
Kate, I don't know if we want to reorder. We have Dr. Stoddard here, so
Oh, sure.
what his agenda looks like for tonight. But I don't know if we want to kind of open with him so we don't keep him.
We can do that. I didn't notice that there was somebody else on.
Yeah. Hi, everyone. Thank you.
Hi there. All right.
I
So
think Kathy just logged on as well as Judy. So not everyone
right.
gets to join and pull up.
So where do you want to reorder to, Miss Mallory?
I guess we'll just jump right into the COVID and inoculation. And I don't know if you have something you want to say, Dr. Started or not, or can kind of give you a synopsis of where we are.
Yeah, I think just a synopsis. I mean, seeing that my name is, you know, kind of medical legally responsible for the clinic, just a little synopsis in any way I can help. And like I had indicated before, there's, you know, certainly plenty of volunteers that are from town that are more than willing to come and help do this. So yeah, I think just fill me in about what's going on and what I can do to be of assistance.
Sure. So I'll start off with Mallory. I'm the admin for the land use department, which also encompasses the Board of Health. And so really right now where we are is we had some trouble getting into the MIIS system. We just gained access this week. So we're starting our onboarding process there, getting ready with Prep Mod. We've done a walk throughout the school, kind of have an idea of how we would make things work when it's time to have our clinics. We're getting a delivery of a deep freeze and refrigerator this week. So hopefully we can store a vaccine. We're still waiting for our approval on the application we submitted to become an approved site. I don't know if anyone else wants to add anything.
No, somebody has some background noise. So if people who are not talking can mute.
All right, guys. So in the last video, I still had a muffler on this thing.
All right. So Judy or Kathy, do you have anything to add to the update?
I would just want Mike to be, if he could forward the names of the nurses, because I really would like to touch base with them and if have them sign in on the Sign Up Genius, and that way we won't end up with 6 nurses for 1 hour and 0 nurses the next.
Judy,
So,
I have those names. I'll forward them along for you.
okay, great, because then I'll touch base with them and we'll get them into the system.
Yeah, and Mallory, I have about 4 or 5 more actually that I can send to you also.
Okay, yeah.
Who are interested in helping out.
Great, thank you.
Okay. As far as you know, what type of vaccine? Do we know what type of vaccine we're getting? I mean, I imagine if we're getting a deep freezer, it's probably not going to be the Pfizer because that needs a specialty freezer. But have they indicated at all what they're sending to the towns?
Not yet.
Okay.
I think Rich said we're probably Moderna.
Moderna.
Yeah.
At least that's what I heard. That's the last one thing I heard. And I know that I talked with Barry today. I got a call from a case wanting to know when that I'd signed off and worked with for a while. He's looking for a clinic. I have another, so he's already had information on Rutland. They're talking February 8th, February 9th, both of those. And I know Westminster had tentatively put in the 22nd, which is the same date we had talked about. So, and I haven't gone through the 1,000 emails that I have today yet. So,
Okay. Well, I'll, no, thanks for the update. Like I said, if, you know, legally I'm responsible for all this, you know, when it comes to the lawyers. So I just wanted to make sure that I was looped in with everything.
Mhm.
We've also visited the school gymnasium, laying out the clinic format. And Mallory, did we have any luck contacting the school administration for the dates we'd like?
I think Kathy was handling that.
Or Kathy was gonna do that? It looks like it'll work in the gymnasium, but on the dates we were talking about, we may have to ask them to go either half day or postpone and go to remote, but we haven't heard anything official on that yet.
Right. We also have to review our plan based on when we get allocated as a site and how many doses we will expect in any given week. I attended a update for the, Mass Boards of Health on the 25th, and the secretary mentioned that they're really just releasing about 100 doses a week per site at this point, and that's been really consistent. And because of supply shortages at this point, they don't expect more than that. That's basically the threshold, and they're hoping to exceed that as they roll forward and try rolling out more vaccine. So we have about 450 seniors. We don't know how many of those are over 75. They also stress that they'd like us to stick to the phases in spirit as much as possible, meaning everybody over 75 first, and then opening it up to the next group of 65 and above, plus comorbidities. But we need to be very careful in that we may only get 100 doses at a time, therefore only allowing us to open up registration for 100 people at a time per week. So we were really ambitious in our planning when we walked through our drill, and we're thinking, 4 days, 400 doses, we can get this done. It may be 4 weeks to get those 400 doses done, just so that the board, your expectations are in line with where the supply is at the moment.
Yeah, and one of the things also at Haywood we found was, we had big expectations. We got a tray of Pfizer, which was turning out to be about 1,100 doses out of the tray, and we thought for sure that the whole hospital would take it up, but it really wasn't. I would say only about 60% of the people in the hospital actually wanted it. So it ended up going to, they called Woods Ambulance, they called the school nurses, so it may, I wouldn't be surprised if you get to the end of the day and, 100 people may have signed up, but only 70 actually show.
Mhm.
So, there has to be, some kind of priority for, who's going to get that next? Is it just a guy on the street? Do you go to the post office and say, who wants a shot? Or are you going to, teachers on the list, because they're in phase 2 also a little, they keep knocking them down, unfortunately, but, a list of school teachers. So that's what we learned at Haywood was that, even though people signed up, some didn't show, and then there wasn't as much of an uptake as we thought.
Yeah, understood. One of our plans is to use the prep mod system, and actually when we do the registration, have a waiting list so that people who would like the vaccine are on a waiting list, and we'll call them and register them ad hoc the day of. So plan some extra hours at the end of the day for that, so that people can come in and get those shots. So that's the goal. And then if we still have shots, it will be, volunteers, public facing folks, people who are at risk, all the above.
Right. Okay.
Yep.
the other thing that we have to think about is the competition, because CBS and a lot of the other pharmacies, some of these senior housing where our seniors live, like for instance, our senior housing is owned by RCAP. I don't know what, I have a contact with RCAP, but I haven't heard anything from them. But I know over at Banal House, they are also private senior housing, and they, their organization contracted with CBS. And gave out 140 Pfizer shots there. So we're in a little bit of competition with the pharmacies. Also, Gardner is going to be a pharmacy site. Again, CVS.
Mhm.
I have my own personal opinion about working with pharmacies. I find that they're not good team players. They at the Banal House, they basically shoved all the, first of all, they said they didn't provide monitoring. And so the manager had talked with us to have a couple nurses and a couple volunteers to help with the monitoring post injection. And they just literally said, you need to get out of here, get lost. This is our space. And it's like, this isn't the first time that pharmacies have acted like that, but they're not really the best team players, but they're going to provide some competition with us, and they may not provide a complete, so we still may be involved somehow, but I just wanted to throw that in as something just to keep in the back of your head.
Yeah, there were some comments on the call with the state board that essentially there are people that are being told by the pharmacies that they can't account for their second dose. So that's something like Mallory, if you get a call from somebody and they're concerned because they've gone to a pharmacy and they've been told, you know, we don't know if we'll have your second dose, that's incorrect, because the reporting through MIAS back through PrepMod accounts for the second dose when the first dose is administered. So our plan to kind of have people register for their second appointment when they're waiting or as they leave the building is a good one, because once that is registered that their first dose has been taken, they're accounted for their second dose, and those doses are sent the week before their appointment in our site shipment. So we're going to have to be aware of that, but we also should make the public aware of that. And to that end, I actually shared some information with Mallory and asked her to share that with the public, because I think we're going to get inundated. Mallory already did first half an hour after the governor's statement that February
Yeah.
1st, right?
Yeah.
We're going to be inundated, but there'll also be questions about people who do go to, you know, super sites, or they go to mass vaccination clinics, or they go to, you know, CVS or somewhere, and then they're concerned about their second dose, or they're misinformed.
Yeah, I know Mallory got it. I got it too. I got a lot of phone calls.
He came back and my voicemail had blown up.
Yeah.
Um,
And go ahead, Kath.
I can attest that people are you know, getting anxious, but I did want to answer his question in regards that I have reached out to Jill, the school principal. It is perfectly easy for us to just use the gym. That's okay. The kids and all the buses are gone by 3:15 every day. So one way to do it is to do clinics from 3:15 till whenever, and then a Saturday clinic. And then that would, you know, give people more opportunity on Saturdays during the day light hours to get vaccinated. I don't know, Mallory, did Hub House folks say anything besides their numbers as to?
But I have a contact up at the RCAP Solutions too, Judy, so I can reach out and tomorrow and see what their plans are if they have any.
Yeah.
Right.
But when and Jamie can be my witness. When we were at Quabbin, and Colleen was there, and when we were at Quabbin, it was mentioned having the clinics during the daytime. The Quabbin came back and said, "We'll just go remote. We'll make accommodations. The clinic is super important." And so I'm not quite getting this principal's you can't have anything until after school's out.
Well,
No,
Wendy,
she didn't,
How
she
could-
didn't, she didn't say that. I didn't approach that yet.
Okay. Okay,
I will ask that now that she realizes, we want to do these clinics.
mhm.
Mallory, I want to go back. Did we get our approval yet from the state?
Not yet, no. And
Okay.
the elementary school they're full in person, Judy. They're not doing any remote learning on elementary level. So they're there full weeks. So if we were to go in and say they need to do remote, I think that would be a big disruption for the school day.
We could
Right.
do, but like
know the
Vinnie
school
said, they could do half days.
The middle and high school, they are doing the remote, but I don't know if that would be something that needs to be approved by someone other than Jill. It might need to go through the superintendent.
All right, I'll hit up, I'll email Jill, both as to half days and such like that. I'll get on that this week.
And if I may add, the only remote days at the middle school, high school is Monday. The rest of the week, Tuesday through Friday, has the kids in. They're just in two cohorts.
Right. I was trying to think, there was something else.
This is Jamie. I don't know when, I know you asked me to come on your meeting and I'm happy to answer any questions or talk through any scenarios with you. But are you guys talking about these scenarios further into phase 2? Are you expecting that you're going to run or be interested in running a weekly clinic? Or are you looking that you're going to do 2 very large scale clinics, or kind of what is your game plan on it? Because if you are talking about doing kind of a couple large scale clinics, I think it's absolutely appropriate for you to ask the school to be remote, even if it's challenging for them for a couple of days, because this is the way you're going to get the vaccine out to your population and get you to the other side of this pandemic. If you're talking about doing this every single week, I don't think it makes sense to say, can you go remote every Wednesday, when you could probably tailor your hours to that 3:30 to 7 or whatever kind of scenario. But if you're talking about getting some heavy doses out, lots of doses out over a couple of clinics, I definitely think you should be pushing the school that we're all on this together, and this is the way that you can help us. And by being closed, it gives you the ability to have your school nurses help us and assist give vaccines, and we would love their assistance, and they know the population and the parents, and I think there's a lot of benefits to that. But I also think that you guys have probably heard, just like I have over the past day or so, that we're in local health, we're considered in a challenging time to get vaccine into our hands. Jana Ferguson told us today that local health is not being given as much doses as we would like to. And I think we all feel like we can get them out faster if they can get them to us. But federally, we're not there right now.
Yeah, and I think we're just walking through this scenario based just to figure out exactly what we want to do in terms of the approach for the clinics, while we're waiting for our site approval and everything else to kind of fall in line, in terms of, access to prep mod, et cetera. I think having a weekly clinic on a Saturday would be completely acceptable, easy to manage, and would probably be able to use the doses that we'd have allocated. And if we ramp up and we have more doses available and there's more need in the community, then we can reevaluate from there.
That's a good idea, Kate.
Would you go Sunday?
I mean, I would. I have no qualms. I don't know if anybody else does.
Like a Sunday afternoon?
Doesn't matter to me.
I could help out. That's not a problem.
And I have no problem with that either.
That probably work for me also.
So we have options there.
So, yeah, so if we need to, we can, if we needed a second clinic, then we could go Saturday and Sunday.
And
So local health has been told kind of recently this week that even the people that already were up and running with clinics for like first responders and such, that they're likely getting around 100 doses a week and no more. I know some clinics that process through 200 people in 2 hours very easily with Prep Mod. They were very happy with it. It worked really well for them. And so they increased to 300 this week, thinking that they could get further through that phase 1, and they only were allocated 100 doses. So they had proved themselves, they had been through it, they had reported, they had accurately given all the information, and they still were only allocated another 100. But I think that speaks to the fact that Massachusetts is getting 86,000 doses a week total from the federal government right now. So they're trying to spread that across these super sites that they're creating and then spread it down from there. And the pharmacies that you guys are talking to, I'd love to hear what your understanding of it is, because what I have some friends that are pharmacists in some of these local chain pharmacies, and they tell me that they're ramping up to get it out. And so I was like, great, the more people that get it out, the better off it is. I feel like we want to get it in people's arms and get to the other side of this. And they told me that they're ramping up. Their idea of ramping up is giving out 5 to 6 vaccines an hour. And so that's really kind of a lot different than what we do in local health. And I feel like for the state touting, we have all these pharmacies. I don't feel like that's going to be the solution.
Right. Well, and the difficult thing is, especially for the initial rollout, it can be very confusing for community members to understand where to go and what the steps are. So I think we have kind of double the effort, right? We have to educate as we go. We have to make sure that there's information on our website that says this is the plan, this is where it falls, and this is the limitations that we're under. So if you absolutely want to get a shot February 2nd, go to a mass vaccination site or go to your local pharmacy and find an opening. And then this is where our plan is, right? To kind of relay all of it, because it can be really confusing. And I know that the closer we get to February 1st, the more people are going to be like, well, how come it's just not here, right? How come you don't have thousands of doses when we're being told it's available? But, I mean, in Hubbardston, we're lucky that we're small and it's a small population, and it's a lot easier, and it's a little easier to manage. So, there's a reason we live outside of 495.
Now-
I am hearing from the phone calls that I'm getting. And like I said, these are cases that I've been following, or family members of cases I've been following. So they may have a slightly different concern, but they're willing to wait for the local board of health. But they just are looking for, dates, and just tell me when they're going to have the clinic. And they're very happy to wait as long as they know that. And I think there's a certain trust for local boards of health. At least that's what I'm picking up. So,
Judy, I've been getting the same.
you're getting the same? Uh-oh. She dropped off again.
Yep, we lost Mallory. We'll wait for her to come back.
Meanwhile,
So-
since we don't have any definite
Meanwhile,
plans
next
yet
steps.
for the vaccine, but we do have the need to make sure the volunteers are vaccinated. Can we make some definite plans for that? We should have enough vaccine someplace, whether it be Rutland or wherever we have to go for it. But I think we've got enough people ready to volunteer for this effort, and we need to attend to them as well. So should we start making some definite plans for that? Whether there's appointments that need to be made at Rutland, or perhaps up at the hospital with Dr. Stouter. We do need to be prepared, and we can't do anything if we don't have the vaccine, but we can get the volunteers prepared.
Or do you mean prepared with a training, or do you mean prepared with the vaccine? Because my understanding is that they're not eligible to receive the vaccine until they're doing the training. I'm sorry, until they're volunteering at a clinic. And so if you were going to try to get them in to a Rutland clinic, I think you'd have to do that by having them volunteer at that clinic. I think that it's not something that we know you're on a list to volunteer, so then that makes you eligible. It's you're actually volunteering, and then that's what makes you eligible.
So the
Right. And
volunteers
Judy
therefore
mentioned
would
when we
not
did
get,
the drill.
I'm sorry, so the volunteers would not get the vaccine to the day of the clinic? Is that what you're saying?
One time I heard them say if you're running a clinic on Tuesday, you could vaccinate your volunteers on Sunday, but it wasn't something that you could know you have a pool of volunteers and get them in today and then know in 2 weeks you're going to have them ready to go. It's not, it has to be actively going to that next clinic
Okay.
to work, to volunteer.
Yeah, you're correct. Some of my colleagues that have been involved in this, the volunteers have been vaccinated first in the morning. So they set everything up. The volunteers, they were there, they were vaccinated, and then the clinic went on.
Yeah, and my volunteers, some of them have been before the clinic and some of them have been after the clinic, but either way, they had to sign up and be there in order to get it.
Okay.
So anything else on the COVID update before we move on?
Are there ways that I can help answer any questions for any of you? Are there ways that I can help support your efforts of what you're trying to do?
Judy or Mallory, anything specific that you can think of that you need assistance on?
Not at the top of my head, but I do have your email. So if there's anything I need, I'm not shy to reach out.
Yeah, I have a straight shot to Jamie.
Judy, I feel like we've been at every single clinic that I've gone to this year, and you could probably recite my speech at this point.
Oh, one last question for you, Jamie. Are latecomers allowed at the webinar you're having on Thursday?
Sure. Yep. We'll be happy
Okay.
to take anybody that wants to come to it. I think it's going to be, there's 88 people on the list that are signed up. So I think it is going to be a really beneficial, worthwhile training on what a volunteer's, role might look like in these actual clinics. So absolutely. Are you guys also exploring still that regional possibility with the Quabbin towns? That I know you guys had representation and it counted as your drill to be out there with them when they did their on-site training and / emergency dispensing site drill. There's a lot of people that were active there. So I don't know if you guys are considering that still as an option.
I guess we haven't talked about that very much, so I guess we're leaning away from that.
The only reason I mention it is because I have been told, I don't know if it will come to fruition, but I have been told that those sites that serve multiple communities will probably get more access to vaccine. And so the smaller one-offs, if you will, and that's not a slam because I'm setting them up in the town that I live in too, but the smaller one-offs are going to get the lower amounts of vaccine. And then the larger clinics that bring people together, it also helps with your resources. It helps with those kinds of things. If you didn't have to get your own refrigerator, I know Rutland has a big freezer and they said they'd act as a depot. Those types of things cut down on what you need to maintain even when you're not having a clinic.
Maybe that's something that we should be doing when it's open to the general public, is to do the regional one so that you get, like you said, more vaccine is allocated to the one site. But I think our focus right now is the seniors and everybody in that next group. But that might be a really good thing to do if we're trying to do general public.
I've heard a lot of towns looking at it that way, that they're trying to reach their population that would have a difficult time going out of their town on site in the town. And then they're going to consider general population, share resources, try to get a larger population through in a day or so. Do you guys have any type of a system in place that you would be capturing people that are interested in the vaccine, just their names and their information? There's a couple of, I think it was Northborough that started it. There's a Google Doc that was created that if individuals wanted to put their name on a list, even if they were in, general population, it puts their name on a list. So you as the Board of Health know how many people in town are interested and what category they fall into. And it doesn't say, are you phase 1? Are you phase 2? Are you phase 3? It asks specific questions. Are you a healthcare provider that is a COVID facing are you facing to COVID patients? Sorry. Are you a first responder? And it goes through a whole list of questions. I think I know probably 10 towns that have put it out now. It's been a fantastic information gathering piece. And then they've been able to take the information and see who fits into category phase 1 and hasn't been able to get access to the vaccine, and then connect them to the area open public clinics. So it is a pretty neat tool, and I'm happy to share an example of it with you if you'd like me to.
Jamie, could you email that to me?
That
Sure.
sounds really good.
Yeah.
Tell me.
Maybe we can work on something like that together. We can get it out over social media and have Ryan do his thing, because he does a pretty good job getting the information out past just the social media.
Mallory, was it you that asked me to send it? I'm sorry. I'm trying to
Yeah.
find faces and names here. Okay.
No worries.
And voices. Okay.
Yeah, it was me.
Yep, sure. I'm happy to do that for you.
Thank you so much.
Do you want me to send it in a generic, like, because the ones that I have, like, say Dudley, Brimfield, Oxford,
Yeah,
do you want me to
can
send it?
you can send it with the town name. which
Okay.
is not
Yeah.
easier. We'll tweak it.
And if you send it to Dudley or Brimfield, it's coming to me. So you can even
Okay.
fill it out and just write test all the way through it so that you can see the form. It's just
Okay.
going to come into me. So that's fine. But I will also tell you, it went out, and in a day I had 97 responses in Brimfield, and Brimfield has about 3,000 people in it.
Wow.
And in Dudley, it was very well publicized, and there's 1,333 people that have filled it out. And they have a population of around 14,000. So just so you know, you'll get people to fill it out, and then they feel satisfied that they're on a list. And one of the last questions that was just added by some of the towns, not all of them, was, are you a vaccinator and are you willing to volunteer? So at the very end of the form, it asks you that. And then, I know you have a super robust MRC, but it also just gives you another resource for local vaccinators if you need it.
Perfect. That's great.
Yeah, and I think it would also probably be helpful to not only understand the demographic population of each phase, but to potentially add to any waiting list we may have. So if we have a waiting list for a given day of registration, we could
Right.
use that as an additional kind of call down list if need be.
I definitely know Upton did that. They ran into sometimes you can draw up additional doses, right? So they had Moderna. Moderna, you don't get as many doses. Pfizer, they're getting at least one out of every vial. Moderna, I think they got 13 doses out of 20 vials. So not every single vial had enough to pull a full dose out, but 13 of them did. But then they had 13 additional doses, and they had only registered what they knew they had. So they had 13 people that they needed to make sure that they could get to. And when they had that list, it made it easier at the clinic.
Great, thank you.
That's a great idea. Thanks so much, Jamie.
Sure, anytime.
All right. Anything else on the COVID update? All right. We can reorganize back to the top of the agenda, and Jamie and Dr. Stoddard, thank you for attending. If you want to continue and listen to our riveting conversation about about failed septic systems, you can, but otherwise, we'll
No, good luck, guys. Thanks. If
Yeah.
you need anything from me, let me know. I'll get Mallory. I'll get you some more names
Thank you
of
so much.
local folks who are willing to help out.
That's great. Thank you.
Same with me
All right.
too. Call me anytime or text me or email me, whatever you need. I'm happy to help too.
Thank you both.
Thanks.
Take
Yep,
care.
thank you. Take care.
Good night.
Good night.
All right, folks. Moving back to the top of the agenda. Review the meeting minutes from 1/12/2021. Does everybody have a chance to review the minutes? And does anybody have any edits?
You'll have to excuse me a minute. I have to walk the dogs. Don't go away.
Okay.
I have not been able to review them. If somebody else says that they're fine, that's fine with me.
I didn't review them because I wasn't at the meeting, but I don't remember seeing them in any of our stuff here. So because we got that, did you put them on the drive, Mallory, or did they come on into our emails?
Yeah, I stuck everything on the drive.
Okay, so I did look at the drive.
Yep.
I don't remember seeing them on there though, but I'll go back. I mean,
Yeah,
I'll look
you
at
wanna
them.
just table them till next meeting then? We can double review them then.
Oh, I like that idea. Thank you.
Yeah, that's fine.
Kathy, it's okay.
Thank you.
Yeah, that's fine by me.
Is any back yet? Nobody.
No.
All right, so we want to make a motion to table these?
I make a motion that we table the minutes from the last meeting till the next meeting.
All right, can I get a second?
I'll second it.
All right, Judy, are you in agreement?
Judy's gone.
Judy's gone.
Oh no, yeah, she is.
All right, I'm in agreement.
Oh, she's
Oh
back
no,
now.
she's back.
Kathy, are you in agreement?
Yes.
Colleen? Judy?
Yeah, yes. Sorry.
We have a vote on the floor to a motion on the floor to table the minutes for approval to the next meeting. Do you approve? You're muted.
Judy, you're muted.
It's, I have to find them. I couldn't find them either.
Yeah,
Yeah,
none of us
I-
could. That's why we're tabling it.
Yeah.
Okay.
that's-
Taking a vote. All right.
And yeah, if anyone needs help walking through the G Drive, please feel free to come in, call anything that can walk you guys through.
Yeah, I mean,
It's new.
I
Well,
was looking-
I mean, I didn't have any problem with going on to the drive and finding it. I just didn't see the minutes there. So I must have missed them or they're not there. I don't know.
yeah, they're there for me. I could see them, but in any event,
Okay. Well,
We'll
they
review
must be.
them.
I probably missed them.
we'll review them for the next one, and that's done. COVID-19 is done. MPH nursing report. Any update on that, Mallory?
I haven't gotten anything new from, well, actually, it's not true. I did talk to Sandy, and I sent out that email from her. We're looking to try to get a grip on how many houses we have in town, that are community living. So the assessing department is only in once a week. They're in tomorrow, and Vin had mentioned maybe they would have what we need. So I'll plan on going over to them tomorrow to see if we can't get a better list so we can get the numbers together.
Good. And Judy, you were going to share that also with Haywood, correct? Or with the group from the call from Haywood that was looking for the information?
Oh, yeah,
Okay.
once I get it.
And
Yeah,
just-
because they wanted to use our volunteers as like mobile teams.
Yep.
Yeah.
So just to update the board, so Judy and I were both on a call for that Haywood coordinated for local towns to just give like a status update and collaborate relative to congregate housing and the end of phase 1, beginning of phase 2. And every town kind of gave an update. And I have to say, because Judy pushes us, we are in such a good place right now compared to a lot of the towns around us. And I just hope you guys all appreciate Judy because I was like, damn, we're doing good. We have some stuff going on. And some of these people are like, we have no idea. We don't know.
I started working on our annual report to get it out for review. And Judy, you have a whole paragraph. It's all about you. You are a star.
Sorry.
No, it's good.
So yes, it was interesting to hear where everybody was. And then Haywood, like the net result of the initial call was that there was a gentleman who volunteered to collect information on congregate housing and, so that Haywood and others could see if we could, collectively come up with a plan. And Judy's MRC volunteers were gonna volunteer to kind of go out to some of those places and help. So it's pretty cool. Right. Where are we? I have
We
to-
haven't had a follow-up meeting there over there.
Yeah, they said they were gonna have one Monday and I never got a meeting invite, so
Right, yeah.
don't know. All right, moving down the agenda, failed systems awaiting action, nothing is listed. So anything there,
I
Mallory?
haven't gotten any new failed systems in.
Okay. Past failed Title V, we have 149 Old Princeton.
That's just a sale.
And it's passed or failed?
Passed.
Okay,
Yeah, we just got the passing Title V report.
okay. Any water tests this week?
None.
All right. Permits and items to be voted on. There's a whole list. How would you like to
Yeah, so
attack it?
all the applications I uploaded into the G Drive
Okay,
to review, but like I said last time, I've only uploaded complete applications. So I have a couple still waiting for and some information that wasn't sent over. And I guess we'll just push those ones for one more meeting. I think we kind of have to be a little lenient this year on the deadline for getting those applications in because everyone's world is still upside down.
gotcha. And in the drive, so I have a question about that. So I have COVID vaccine, what you need to know. I have advisory, COVID order. I have the meeting minutes, and I have the agenda for tonight. Those are the only things I see. So when you say you
Oh,
loaded them to the G Drive, where did you load them?
I did. That's weird because I have
Yeah, that's all I saw too.
permits to be voted.
I don't have them.
You don't have that?
Nope. It's so I'm in the let's see, shared drive, Board of
Yep.
Health. When I click into
2021 meetings.
2021 meetings, hold on. Okay. So you got to click into the meeting.
Yep.
So there's a folder you have to click into. Then there's another folder you have to click into, and then permits to be voted. Okay,
Yeah, that's kind of where I put.
got it. Now I know where to look. I see them.
Yeah, that's kind of, I figured that's how I do it for the other boards, just kind of break it down by agenda items. And that way it makes it easier for if you ever have to go back to, instead of going through emails, you can just look at that.
Yeah, I'm gonna. Can you make me a presenter, please?
I don't know, can I?
I don't know. Can you?
Let's see. Town BOH, more.
I just want to make sure everybody knows how to do this.
Yes, I can.
Ben, are you back?
I am back.
Good, good.
It's not gonna make you a call one, it's gonna make you the whole shebang. So it's
Oh.
all you.
Oh, goody, good. Let's see. What do I want to share?
Can you just make sure it's still recording on your end?
Oh, yeah. Sure. 1 second. It is still recording. Okay. So when I am, so say I'm here in my handy dandy notebook and I'm on my Gmail, right? Click here. All right. Go to my drive, this little icon down here, which is the weird rainbow triangle. All right. Then in here, this is my drive. So this is just stuff that I've saved here. You go to shared drives here on the left, Board of Health. So you click there. There's documents that are active, and then there's a folder. The folder at the bottom will be by date. And then here's our agenda for tonight. Here's COVID info, permits, Title V, and turnover. So that's everything for the meeting for tonight as dated.
That's why I didn't see it because I didn't
Yeah,
go that
me
far
neither.
in.
I didn't think
Yeah.
to go into the folder. And here are all the permits to be voted on. Just so everybody knows how to get at it and we're all on the same page.
Awesome. Thank you.
Right. That's nice. Thanks.
Beautiful.
All right. Now,
All right, where do I pick it up to begin with? GoogleDrive.com, is that,
so you have your Board of Health, you have your Board of Health email address?
I'm not on it if I do have it.
Well, you,
I'm just on my Hotmail address that opened
Yep.
up the meeting.
so you, you're gonna need to go into your town Board of Health, whichever member you are, email address, like sign into that on Google. And then when you're in your inbox, there's a link to the drive.
Okay.
So the first step is you're gonna have to log into that Gmail account. So if you want to follow up with Mallory, if you want to get Vinny
I'll
logged
get you
in.
the information again, Vin. Not a problem. Vin, do you use your Chromebook?
I do not.
Okay.
I'm on Google Chrome with my browser.
That's okay. You'll just have to log into the Gmail and into the accounts that we have for you. I have your password and your email saved, so I'll just get that information over to you.
Okay. Now, given that, what are we doing with these permits we
Well,
voted
yeah,
on? tonight?
so seeing how no one reviewed them, I guess we have to table them. There's a couple installers in here that need their permits to do some jobs
Right.
in town. So I don't know if we want to share the screen for the installers, the 2 installers at least,
Sure.
and get them taken care of.
Yep. Tell me who they are and I will open them.
Yeah. So there's Sparsk. There is MJC, Peter Lyman, and Jay Kelly. And they're all have been installers in town before. Nobody's new. So it's not like we're looking for any like letters of recommendation or anything like that. Everyone's worked in town before. They just need that license in order to do those jobs so that if something goes wrong, they're not penalized by the town.
I would personally approve all those guys because I've worked with them before last year. So if we can share and take a look at them, great. Otherwise, I could review it and go to the office and sign everything Thursday, Mallory.
Sure, we can either do it that way, or if your schedule is too busy, Kathy, I can send everything
Yeah.
over. No, okay, no worries.
I can do it Thursday morning.
I'll be there.
Okay.
That works. If everyone's
Okay.
okay with it.
Have not had any issues with any of those installers in the past year.
Okay.
And so I would be okay with signing
And
off
then-
on their permits.
What I'll do then is for the next meeting, so tomorrow when I go in, I'll make a folder for next meeting that we have, and I'll just add all of those applications right on in so that you guys can start poking through. You have 2 weeks to kind of review them.
Yeah, sorry about that. I got kicked out just as I shared my screen.
No worries. We
It's
decided
okay.
Kathy's personally worked with all the installers, so she proposed the idea of approving them if everyone was okay without reviewing.
I'm fine with that.
That's fine.
Yeah, I'm fine too.
Thank you.
Very good. I'm going to stop sharing my video because I'm having connectivity issues. All right. Next item is. I'm going to back up. So we're moving through permits and moving into open repairs and inspection.
I haven't gotten anything new in. As far as I do have one application, which was pending the installer's permit, Kathy. So you can take a look at that because that's something that you usually approve on your own anyway when you come in on Thursday.
Okay.
So I haven't gotten anything new plan wise or anything like that. Everything is kind of on building and new plans come in slowed down. Tim Newton, I guess that's down below, but he did get called out today to do a perk off Brigham Road. So I haven't had a chance to add that to the agenda, but he did do a perk up there today. But other than that, new stuff has kind of slowed down.
The weather will do that to you.
Yeah, as much as I don't like it, I'm welcoming it this year.
I know. Same here.
All right. So no updates on any of those. The one perk is not listed. Will be in the next meeting. Open complaints.
Just those two trash.
Judy, I never got an email with the phone number of the owners of 248 Gardner Road. So Vinny and I didn't make a visit because we didn't have anyone to talk to ahead of time.
Yeah, and I did get an update on Craig Halfrates, and that's why you didn't get it. There's some family, personal business, so I sort of backed off a little bit until that settles
Sure.
down.
Sure.
So, but I'll ask again.
Thank you. So Vinny and I did not do an inspection on either property as of yet.
I'm assuming the next time for an inspection would be what, when the snow is cleared or if it melts. So potentially not for the next meeting, but keep it on the agenda and we'll just keep tracking it.
Yes.
I think that's one of the things that will just stay on and we'll just keep tracking.
Okey-doke. All right, new business. We discussed already at the top of the hour in terms of the COVID updates with the 2 guests present. Is there anything else that has come to mind since then that we want to share relative to the inoculation clinic or the
Yeah.
MIS?
So I shared some documentation out to the entire board, including some onboarding videos through MIIS. I was able to get us approved to begin the onboarding process. In the first video that they watch, that they have you watch, they said the onboarding process can take anywhere from 1 to 4 months. So I'm hoping ours goes around pretty quick. They also suggested having more than 1 administrator. So I think we talked about making Kate the second administrator, but I won't be able to give you little pieces at a time. So I won't be able to make you an administrator yet, Kate. But there'll be some more training that comes along with that. So what they suggested is that video that I sent out in the email. It's about 10 minutes long. Anyone who's interested in becoming a user on the system just watches the video. And there's some links inside the video that you can click on that will take you to some of legal points of reference for members using MIIS, like the right to refuse. A patient doesn't have the right to refuse having their information put into the system, but they have a right to who can view it within the system. And that's something we have to be really careful on while running these clinics. So I just suggest anyone who's going to be inputting data takes a look at those videos, and I'll just keep forwarding them along as I get piece by piece and from the state.
Very
Now, is there any way we can find out if there is another town planning a regional clinic that we could piggyback on?
There is, well, we can look at a couple of places to find out where there are regional clinics. There's actually a map that they're maintaining on the mass.gov COVID vaccination website. And then, you know, we can look there, but we're already aware of the 2 local regions, if not more, right, Judy? So Quabbin and Montechusett.
Right.
So when is Quabbin planning theirs?
They're still in the planning stages. That's why I was talking with Andrea today. But you know, this vaccine has been paid by us, you know, as the taxpayer. So anybody can go anywhere to get the vaccine. So, but if we wanted to, you know, promote and encourage and participate and support a regional like over at Quabbin, that's how we would get involved. Or if we wanted to sync up as a partnership with Gardner, for instance, that's how we would get involved.
Well, if they're already planning it, are they going to invite us, or do we have to request to participate through them? You know, what's the method of cooperating on a regional basis?
Well, considering how connected I am over there, it would be, you know, that would not be a problem. I don't think, in fact, I think Andrea would love to have us join her, because their board doesn't really, as Kate mentioned, there are a lot of boards that really don't know, that haven't got a clue. And their board that has kind of stepped away and said, you know, work with Judy, work with the other towns, and, you know, work with them. I know Hardwick and New Braintree are looking at clinics and having small town clinics, in addition to joining on with Quabbin. So they're looking at the hybrid model like we had mentioned too, of, having small clinics in town to meet, certain populations, and also joining in with Quabbin.
Well, I'm not adverse to what we're doing. I think we're on track for a successful clinic. However,
Right.
if in fact they're going to make more doses available through a regional basis, and it sounds like the way they're distributing this stuff, we may do a lot of planning for 10 or 11 people during the course of a clinic. That doesn't make much sense if we can get something that's going to be more popular out of a regional situation and
Yeah, I mean,
service more people.
I don't necessarily think that that's going to be the case. I think that if our target clinic for the initial, for phase 2 is seniors in town that have limited mobility or access to transportation, and
Right.
folks in congregate care in town, and we're making sure those folks are getting picked up and managed by pharmacy or other resources. And then we look at, teachers in town, other people in town, because it's rolling, right? So phase 1 never closes. You continue. Oh, phase 1 is open, and anybody who falls into phase 1 can get a vaccine from now until they stop giving them out. As we open phase 2, if we're handling our local population of seniors and folks that have limited access to transportation, um, we're still gonna be able to manage a lot within the town. There will be people who want to wait and that trust people in town more than just some stranger at a pharmacy somewhere. But I think we need to do all that. I think it's fine to also team up with the regional and refer our folks out if they want to get vaccinated sooner, because we may not have the doses available. And then finally, I think that we need to communicate to our citizens very concisely what the overall state's stance is and what our plan is and where we are with it, because it can be really confusing for people. And they need to understand is, each phase has sub phases, right? And we'll do everything we can if we have additional doses to just roll them out to people within that phase and follow the spirit of it. But they are always welcome to approach a pharmacy, go to a mega site, go to a regional site. There's no barrier. You don't have to show an ID. You don't have to be a member of the town. The only reason people in our town would be drawn to our clinic is because we're contacting them to register. But fundamentally, Vinny, if you wanted to go to Quabbin and register and you fell into phase 1 or phase 2 guideline, you could do that. Right?
So that's what I was concerned of, Kate, that they would call us up and say, well, you didn't register. Hubbardston's not part of this regional, so we're not going to service anybody from Hubbardston.
There are
No.
public and private. There's very few clinics that are being run as private clinics. Almost all of them, and they're all listed on the mass.gov COVID vaccine website. There's a map, are public, meaning you don't have to live in that town.
Right.
You also don't have to show ID. You just have to register. So all you need to do is contact the clinic in some way and get a registration web link. And most of them are, because they're public, they're on that web page that Judy shared for the phase 1, where you can look it up and just sign up. And the mega sites are multi-regional. So you can just go to Gillette Stadium, for example, and, if you fall into the phase 1 or phase 2 category and you self-attest to that, you can get vaccinated.
Yeah, and most of the towns, just like us, we're learning Prep Mod, and you just go to maimmunizations.org, and that'll be listing more and more of the clinics as they come on board. And the other thing too, even the general population, you're not going to get young families or the older folks who want to stand in a line for any length of time. If they're going to want, to come to a smaller clinic where there's in and out, and they don't have kids running all over the place or whining. And don't forget, when we finally do get a vaccine that can be given to children, then we have another clinic altogether.
Mm-hmm. Right. And this is going to be, if we get 100 doses a week, and we do a weekly clinic to hand out 100 doses, we're going to be doing this until the fall.
Right,
Right.
right. And when it comes to children, pharmacies do not do children.
Right.
So this is going to land on our little group from Hubbardston and other volunteers.
Now, I did ask Valerie to attach a document and it's in there. It's actually from Fallon. I just thought it was a nice, concise update, and I'd like to kind of copy the format and and maybe update it with some new information from this week, because it was definitely as of last week. But it was just a one pager that had information for patients 65 or older, a general update, and then within that it listed that the federal government announced that 65 and older would be included, in phase 1, and that 75 years or older is beginning in February. That lists the Brigham website, which I think we should probably list like the Massachusetts website. And then it has information for pregnant or breastfeeding patients. Where will the vaccine be available? How will I know when I can get a vaccine? And there's that graphic, the phase 1, 2, 3 graphic, which I think we could put up. And, I do, in terms of where it will be available, what I'd like the public to know is that there's going to be mega sites, there will be regional sites. Here's the website you go to find a site close to you. And in addition, the local Board of Health will be hosting vaccines starting in the middle of February, starting with people at 75 and older in phase 2. Just to put it out there and give everybody kind of a one-page place to go to kind of get all the high-level information they need and let them know what it is we're doing. And that way, Mallory, when people call in, you can actually give them the link to this and refer them to the website as well, so they have it to go back to.
Right, and that would be a good way to segue into that. Are you going to be interested in coming to Hubbardston for your vaccination? And if you are, fill out this form.
Yes.
And then if not, this is where you find those other sites.
Do you want me to take a shot at writing out the copy for this, and then you guys?
Yes, please. Yeah, go for it.
Yeah, that sounds like the piece of the puzzle we're just not capturing yet. So that sounds like a plan. Wait,
And I got the forms over from Dudley already, Kate. So I'll take a stab at that in the morning, and then we can just kind of try to get it together for the report that comes out every Thursday.
Okay, cool.
And send it out to all of us to review before we send it out to the weekly report.
Okay.
Thanks. Thank you.
I think the bottom line is, like Katie says, a lot of it's education, but it's also just making sure that people understand they have options so that it will fit to their
Yes.
schedule, their work schedule, their school schedules, whatever, that there are options out there, and it's, they can go anywhere to get it.
Mm-hmm. Yeah.
Right.
And I think also it's worth noting in here that, they can go anywhere to get it. And the state is trying to ensure that there are no barriers for individuals to get it. So it's free. If you have insurance, the clinic you go to may request the insurance information and bill your insurance company. If you do not, or you can't provide it, it's still free. So,
Absolutely.
and you don't need an ID, but you may be asked at different clinics to fill out a
Interesting.
can't say the word. You may be asked to fill out a self-attestation. I can't say the word. Attestation. Thank you. Form, depending on the clinic you go to. And we, as a group, haven't discussed whether or not we would require those documents. I don't see the point. I think it's extra paperwork because we're not going to check and follow up. We have no way to check against HIPAA if somebody has 2 comorbidities or not. And even if we were somehow to know or find out, are we going to really are we going to penalize somebody under the penalty of perjury because they got a shot a month before they should have? I don't know. I mean, we should, yes, but I think we should just take it on faith that people are going to act in good faith and not, try to jump the line unnecessarily and just let it go at that.
They're gonna come out and tell you anyway, or they're gonna ask. That was one of my phone calls that I fielded. It's like, I have XYZ, would I still be eligible even though I'm only 68 to be fitting into that category of, comorbidities? And she just freely shared what was going on, and I said, yes, absolutely. So, they're gonna share anyway. I have something, a late breaking news, like they do on TV, breaking news.
Sure.
Don't stand in front of Hubbardston.
FEMA released some guidance on vaccination operation costs. So it looks like, and I'm looking at this from Dennis's phone, so I'll have to go hunting for this information. But it looks like for those who are registered for FEMA public assistance with FEMA grants portal account, then we are, the town is, okay, the town is, a streamlined project application may be submitted to cover actual vaccination costs from January 20th, 2021, or for estimated costs for the January 21 to 2021 to September 30th, 2021, 100% period. So if you have immediate critical funding need, please reach out to your MEMA program coordinator, which I think is Kevin, right? Kevin, yeah. Yeah, so if you like, all of you probably already know this very, very well, every field has to be filled in. So on government documentation. So we do have a good pool of money. So, but it's just something that here's another availability in case we do other things, like if we have to provide and pay for transportation for some of our folks to get to clinic or something like that, that would come out of our pool, but it may also be reimbursable.
Right. Or EMTs for the day.
Right, exactly.
Right.
Right. So just something to keep in mind.
Thank you. Do we need to make a motion to approve the cost of the freezer and the refrigerator that Vinny has spent time, getting
Yes.
all of that in order? I think we do, don't we?
Yes, we do. We had to defer that from the drill. Oh, am I muted? Did you hear me?
Do we have an invoice yet?
No, not yet.
Okay.
You approve it when the invoice comes
Yeah.
It's coming this week, right?
Thursday.
They should be here Thursday.
Okay. Just trying to stay on top of those things since you were talking about costs.
Mm.
Well, we have $3.99 on the freezer and $2.49 on the fridge. You want to, we could make a motion, if there's some error there, maybe we could do a $700, $800 appropriation to pay for those if you want to do it now. 6 one, half a dozen the other.
Mm.
So I'll move we appropriate $800 for the freezer refrigerator purchase.
Second.
All right. All in favor? Kathy,
Yes.
Vinny,
Yes.
Judy,
Yes.
Colleen,
Yes.
and Kate is a yes. Motion passes.
So if it comes in at more than that, we can just have to revisit it, but that should cover what the
Right.
quotes were to me.
Did we
Thank you.
figure out where we're putting it?
Mallory's office.
We got to get a dorm.
Build an addition.
Next time on the agenda, are we ready to move forward? If I can find it. I have so many tabs open, it takes me a minute to find it. Okay, there we go. So we have covered everything except for any appointments, none. And old business, food inspections, and budget spreadsheet. And Mallory, are you there?
Yes.
All right. Who's ready for a food inspection again?
Yeah, if you'll put a list together for Kate and I, so
I
we
can do that.
can, that'd be great.
First,
Then I can just call down that list. And then budget spreadsheet that was attached in the Drive documents as well.
we
I
didn't
did
have
not,
any- Yeah, we didn't have any invoices. It was only the turnover that I sent in for, just trying to find the document right now, for permits and for
Tim?
septic.
Yeah.
So there's- Oh, no, I lied. There is one invoice. We got Tim Newton's invoice for his work in December. So he did 6 perk tests, the 3 on Lombard Road, and then the 3 on Old Princeton Road. I'm sorry, 7 and 1 at 35 Burnshirt. So 7 tests at $75. We owe him $600.
Okay.
and he's turned in the paperwork on all of those.
Yeah, he's been great. I get the paperwork almost instantaneous from him.
Woohoo!
I'm really, really, really impressed. And then as far as turnovers go, we did a turnover of 205 into the septic review and a turnover in the amount of $1,940 into our split revolver and general fund account.
Okay.
Okay,
We have more than enough money in both accounts in the account to cover for the perk test that Tim does.
All right.
I make a motion that we pay Tim's invoice for $600 for December.
I'll second that motion.
All right. All in favor? Kathy,
Yes,
Ben,
Yes,
Judy? Judy, you're muted.
all right.
Thumbs up, Judy? Thumbs up.
My sign language.
Okay. Yes.
And
and-
Colleen,
Colleen?
Yes, yes.
All right. Kate is a yes. Motion passes. I wasn't looking at the screen, Judy, so I couldn't see the hand wave.
Yeah.
All right.
All right, we're in good shape.
Anything else on the agenda? Any unexpected subjects or new business people want to bring to the floor?
I'm just going to give in a quick update that my black male miniature schnauzer, who has been lost since last Thursday night, is still not returned. So not very hopeful that we will find him.
I'm sorry, Kathy. That's awful.
Yeah. One of those things.
Yeah.
You decide that we have a brother and sister, and they decided to go chase a deer. Must have been just
Oh.
right ahead of them and went down towards the Burnshirt Creek and everything. So I am worn out from going out and looking for a dog. We did get the sister. She showed up when we were walking Thursday night right away. But Charlie we haven't found. So anyways, just that's been occupying a lot of my days since then. So
Yep.
Otherwise, everything else is, I think I'm keeping up. If I'm not, let me know if I miss anything.
No worries. Yeah. Sorry about Charlie.
sorry to
There's-
hear that. What a shame.
you know, but
Yep.
like Mallory's before the meeting started, we're both like, maybe, somebody who just, I don't know, just took him in. You never know.
Yep. You just don't know what happened.
Yep.
It's absolutely true.
Do they have chips like
Our
Is he
dogs did
chipped?
not.
Oh.
No, they were not. But we've done all the things that the group Missing Dogs Mass recommended. So it's, it's all been done. So,
It's all over my Facebook page, Kathy.
oh,
Probably had
sorry. Okay.
No, it's good. I've probably had about 15 friends from Templeton to Athol to Gardner, everyone sharing it. So it's kind of neat to see a community come together like that.
Thank you. It's just one of those things. You never know if you're driving somewhere and he'll
You
be
see
on the
him.
edge of the road or something,
Mhm.
That's what I've been told. So we'll see.
More people I can reach, the better.
Yep, absolutely. All right. Have fun shoveling snow tomorrow.
And with that, more new business.
Not looking forward to that.
Make a motion
I
to,
know.
can we make a motion to adjourn?
I make a motion to adjourn.
All right.
I second it. I'm hungry.
All in favor?
Me too.